Thank you for joining us on Highly Detailed News. We are so fortunate to have joining us today Sweetleaf Joe. He is the founder and director of the Sweetleaf Collective, located in the San Francisco Bay Area. They have been helping low-income and terminally ill patients receive free medical cannabis since 1996. In that time, their patients have received over $3 million worth of free medical cannabis. He is here specifically to share his wisdom and his experience and talk about Sweetleaf's goal of doing $1 million in compassionate donations this year. How are you doing today, Joe?
I'm doing well. Thank you for having me.
Yes, it's our pleasure, really. I'd say, briefly, I guess, just go over what it is you do specifically for people and how you would talk about how we can keep the idea of compassion alive as we move forward from the medical laws into the recreational laws.
For sure. Well, there's two different ways that we've been doing things. There is the pre-64 era of Proposition 215 and now the post-64 era. So in the 215 days, we would go to farms and pick up donated cannabis, bring it back to the Bay Area. We would package it up, and then we would bike deliver it to our patients' homes. And these are all low-income, terminally ill patients, primarily HIV, AIDS, and cancer patients. And, we were sort of handling everything before. Now with Prop 64, we are no longer allowed to be plant touching because we don't have a permit. There hasn't yet been a nonprofit permit category created. We have petitioned the BCC for that. So we'll see. Fingers crossed.
Right.
I mean, we know BCC, they just really move slow. I understand, they're being cautious. But, it would be great to have a little more support from the BCC in regards to the nonprofit sector of the cannabis industry, which, is where we're at. So now the post Proposition 64 days, now that it's legalized, we are no longer allowed to be plant touching. So we are more of a patient organization now, and we organize patients to help them access free medical cannabis. And that entails, we work with donors, we work with dispensaries, we track donations down the supply chain. And when they get to the dispensary or the delivery service, we organize our patients for either a delivery or when they have to go to the giveaway and pick it up. And yeah, so it's been interesting. It has been a big change. Things are a lot more remote now, not just because of COVID, but because we're not allowed to be plant touching. So we have begun to focus a lot more on patients and also another thing we're starting to do is our donors are starting to contribute a lot more cannabis, a lot more medicine. Yeah. And so we have started doing compassion distribution. And that's sort of a side project called Team Compassion, but it's basically Sweetleaf. And so with Team Compassion and Sweetleaf, we have a goal of doing $1 million worth of compassion this year. And Amazing. We are already over $500,000 that we've done. We had a giant donation from Sonoma County cultivator, Soma Rosa Farms, and they donated 120 pounds of retail ready flower to us. That has a retail value of around $600,000. And we have already gotten almost 2/3 of that out to our patients and to our partner dispensary and partner compassion programs. And so, so we're really well on our way to hitting our $1 million mark. And it's really exciting. Of course, the only big hurdle for us, and it's always been this case, is the finances and the funding. And it's classic for all nonprofits. We all have to have little bake sales. We've been selling lighters at dispensaries, so that's one way that consumers can participate. And I don't know.
No, it takes every little bit. I encourage everybody to keep a lookout for those lighters and pick them up for you, because it does. It all adds up, and it definitely helps. But yeah.
Yeah, and the
I'm
lighters
saying,
are pretty cool too because we quantify the impact for the consumer. So for every lighter purchased, it pays for the overhead for Sweetleaf to organize a patient to receive 3.5 grams of medical cannabis. So,
amazing.
consumers get to participate in compassion.
Yeah, that's incredible. Real quick, I guess can you quickly explain what is compassionate care and how that differs from adult legal use or recreational use laws that we have through the country?
Yes, definitely. So compassionate cannabis is always medical. It's for medical patients, and it's primarily, at least for Sweetleaf, it's for low income. We specifically target those who need it most, and we target underserved communities. And so compassion is patients being able to receive free cannabis because they can't afford it, and they might pass on if they don't have access to this cannabis. And we saw that happening when Proposition 64 passed and SB 420 sunset. That was a law that created the collectives, the whole collective model where dispensaries came out of. And so a lot of compassion programs had to close in 2019, and we saw patients passing on because they were not
It's not
allowed
able to
access.
receive their product. That's incredibly sad. It's been a very odd year for organizers, unfortunately, and the compounding issues of the past year just make everything so much more difficult. Hopefully, as we start to get everything rolled out and safer, we'll be able to get back to the more face-to-face community stuff, because that, I think, kind of helps fuel people's hopes as well. Being able to see friendly faces and when they get their medicine is probably a very important thing psychologically that they've just lost.
Mm-hmm. Yeah, for real, for sure.
Yeah.
And it's hard because our patients too, especially during COVID, I mean, these are the most vulnerable to COVID. Their immune systems
Definitely.
are already compromised.
Yeah.
And cancer patients, their immune systems are compromised too. And so that was really difficult. We were lucky. I'd like to give a shout out to Padre Moo. That's the delivery service that we work with. Previously, we had been working with Spark, and patients could come in and pick up their medicine. But once COVID happened, we didn't want them getting into groups of people. We didn't want them leaving their homes if they didn't need to. So Padre Moo really saved the day for us. And
amazing. Yeah, definitely.
Yeah, they started doing deliveries all free of charge. They're donating all their services, and they're a delivery service in Oakland. They're an equity business, and they're really great. So anybody who's hearing this and you're in the Bay, check out Padre Moo. They're great.
Definitely. Yes. Always support those who are doing things to actually help people. Always. So as the laws have changed, I know you covered it a little bit. You mentioned that you're applying for the nonprofit status. Once you get all of these steps taken care of, what are the next steps for Sweetleaf? What are your goals as you? It seems like you're going to absolutely crush your mark of the $1 million this year, and so hopefully we can keep pushing for that. But yeah, what's next?
Well, let's see what happens with federal legalization.
Yeah.
Basically, I feel like the compassion programs in California will be able to, spread out to other states. Some programs have already done it. Weed for Warriors is a great example. They have chapters all over the country. But most of the compassion happening in California is California-based organizations. But we're the ones who have the experience, and we had a big lobbying battle to change California law in regards to Proposition 64. There was a big oversight in that law where they didn't make a distinction between commercial and non-commercial cannabis. And what that meant was that non-commercial free compassionate cannabis was being taxed exactly the same as cannabis that was being sold. So, for example, like I'd mentioned in 2019, a bunch of compassion programs closed. Patients were passing on. Sweetleaf, we didn't close, but we had to do fundraising to pay the state taxes so that our patients could receive free cannabis. We did not want to pass on any cost to our patients. Our patients have never, ever, ever, ever had to pay for anything involved with Sweetleaf.
Amazing.
And yeah, so we had to do fundraising. That's where the lighter program came out of. It was originally to pay the taxes on an eighth of cannabis. So we fought it. 2018, got it all the way to the governor's desk. It got vetoed, so we had to do the law an additional time, SB 34. And that time we got it passed. So it's the first time. This is a really major thing too with this law, because it's the first time that a large governmental organization, a large governmental entity has acknowledged the nonprofit sector of the cannabis industry. And that's a big hurdle, another big hurdle that we have.
Absolutely.
People don't realize that there's a nonprofit sector. You know, people think of cannabis like alcohol, and they're like, you know, oh yeah, medical alcohol, medical cannabis, like that's just a joke, you know, people just want to get fucked up. But in actuality, we have an endocannabinoid system, and, you know, cannabinoids are super important for our homeostasis, you know,
absolutely,
for our bodies to be functioning properly. And so when we first started our lobbying campaign, you know, people were telling me to look at Colorado and Washington and Oregon and to see what the nonprofit sectors there did to protect compassion. Unfortunately, what we found is that all of those compassion programs just disappeared. And because we have the history here in California of being the first state with a medical cannabis law, and that law coming from the patients, you know, it was Dennis Perone practicing compassion, giving away free cannabis to HIV and AIDS patients in San Francisco General Hospital, that, you know, really helped change the narrative. Like, this is life-saving. This isn't a drug. This isn't heroin. You know, this is something that can save people's lives. And we're lucky that we're in California and we have this activist history. And what we saw with our lobbying effort is we had activists from age 20 to age 80. It was multi-generational. Compassion activists from the 80s, from the 90s, from the aughts, and from this previous decade, all coming together. It was magic. It was great. It was an incredible grassroots organization. And as much as it was a hassle, it was a good thing, because for 2 years we fought for compassion and it became an issue. Now politicians in Sacramento and California, they understand that the cannabis industry has a nonprofit sector and that it's vibrant and that we're really helping a lot of people. And again, so bringing it back to the importance of this law, and the reason that we did it, you know, it wasn't just to protect my patients or protect the veterans or anything like this. We knew that our actions in California were going to have a ripple effect around the whole country and then around the whole world. Now, because we got SB 34 passed, right now in Washington, D.C., they're discussing federal legalization. They have invited nonprofits to the table to discuss how that is going to look. So thankfully we did that here in California, because if we didn't, we would probably have a similar situation to Washington, Colorado, and we'd have that situation for the whole country.
Oh, that's amazing.
The issue is that literally millions, and this is just in California, millions of Californians qualify for compassionate cannabis. Like, this is huge. Like, so many people need it. So many people will benefit from it. And it can't go unnoticed. It can't get swept under the carpet. We're not.
It is nice that a lot of times here in California, we are still able to remind people where we've come from with this industry. We have an incredibly long history of activism, especially in the cannabis industry, that other places don't have. I do see some pros and cons, because we talk about there's some incredible growers I've met out of Alaska because they have these beautiful controlled environments that they get to hang out with 6 months of the year when there's no sun and get their UV rays hanging out with their plants. I absolutely love talking with those guys, but they're very underground, they're very reserved. And so being able to have people that have proudly helped champion this plant for so long have representation at the federal level is nothing but a good thing, in my opinion.
Yeah, I think it's really, really incredible and super important. And like I've talked to Ryan Miller from Operation Evac and Sean Kiernan from Weed for Warriors, Melissa from Dear Cannabis, but we have a really incredible opportunity right now. So I've been in the nonprofit sector of cannabis for 25 years. I started the program in 1996, and this is the first time we've hit this point where we are getting public recognition as the nonprofit sector. And like I tell the other compassion programs, I'm like, we have an incredible opportunity right now to build the nonprofit sector from the ground up.
Yeah.
Like, we are the innovators. What we do here, they're going to look at in Washington, D.C., and we're going to be the living examples. We'll be like, see, this is how it worked. And this isn't theoretical. This is what we do. Like, for example, we just had a giveaway, our first real giveaway that wasn't a delivery since COVID started. And we had it last Friday at California Street Cannabis. Great dispensary in San Francisco, super supportive of compassion. They do Operation Evac there, Weed for Warriors, Sweetleaf, Brownie Mary. They do lots of stuff. And so we had a giveaway last week where we gave away almost 20 pounds of cannabis to our patients. They had a retail value of almost $100,000.
Wow.
We did that in a morning. It was like an hour or two. And so this is really good because we can present this to politicians. We can present this to policymakers, and we can say, look, here's how we do it. I had a meeting when SB 34, when it was looking like it was going to pass. And so the different California organizations, entities, like the CDTFA, governmental entities that handle taxation, the BCC was there. Lori Ajax, who was the head of the BCC, was in that meeting. And basically, they were asking me, I was the only compassion person in this meeting. Senator Wiener's office is there. The governor had a representative there, and they all asked me, how do you do Sweetleaf? How do you intake your patients? What paperwork do you do? How do you verify paperwork? What all do you verify? And I told them everything. They wrote it all down. And then like a month later, the state issued their guidelines, and it was verbatim what I had told them. And that's what we do, And that's a great thing. We are building the nonprofit sector, but we're building the larger entity of it because the smaller organizations, we're already doing it. And so we want to scale now. We want to take care of more people, and that's like Team Compassion. We're sourcing donations for other compassion programs. We're like helping create more access, giving these compassion programs more donations so that they can take on more patients.
That's incredible. We absolutely love anything that empowers the patient side because, like you say, far too frequently, corporate-sided cannabis is only minded upon potency, getting completely wasted on whatever. And there's so much that we're missing that just used to be the true conversations of cannabis. I feel like we aren't having anymore in a lot of the places we go to buy it. So I am wholeheartedly supportive of making sure we don't forget where we came from. I guess real quick at the end, where can people find you? How can they support? And what else can we do to make sure that this keeps moving?
So you can check out Sweetleaf Joe on Linktree. You can do Sweetleaf Joe on Instagram, Twitter. We're looking for more volunteers right now. We're looking for more donations for funding for cannabis. We could really use a social media helper. I'm kind of old and not as savvy as these young kids these days. And how else? You know, check out the link tree, check out our website, sweetleafcollective.org. Purchase lighters and rolling papers at participating dispensaries. Yeah, I think that's most of it.
Yeah,
Sorry,
that's a great what help. No, I love it. That's what they should. Please, all of it, go do it as best you can. We are so incredibly fortunate to have you. Thank you again so much. We will see you soon, hopefully.
Awesome. Thank you for having me. It's been a pleasure.